talking about peripheral neuropathy. That's a mouthful, I know, but it's any peripheral neuropathy is any processes, any nervy like symptoms going down your limbs, such as numbness and tingling, weakness, achiness down the arms or the legs. We talk about it as if it's a sciatica, and a lot of people think it's an impinged nerve. What does this all mean, and what does that mean for you? So a lot of the times, if you can look at your skeletal system, the structure of the bones, you have to remember that the bones are slaves to our muscles. So a lot of us have dominant side, which is typically the right side. Some of us are lefties, but a lot of us are right-sided. And a lot of us have propensity to be one-sided. We lean to one side, we cross our legs, we drive with the right foot, brake with the right foot. It's all like based on right-handedness in this world. So when we talk about that, and we have a lateral lean of some sort, and when we talk about the postures, or any of the sports that you play, based on your handedness, we're going to be using one side over the other. And so this creates a compensatory pattern or dominance by which it sets the pelvic alignment out of whack. So if you can visualize your tires, we need them aligned properly so that we can use and wear out the tires in a proper manner so that they wear evenly. But over time, what happens if we don't regularly rotate them or align them, one of the tires will go faster than the other. That's not what we want because we don't have replaceable parts. So then what we want to do is periodically make sure that we're properly aligned. And we do that by I utilize what's called a muscle energy technique as well as a joint mobilization technique. I always start at the base of the pelvis because that sets the base for the spine to sit on. So whether you come in with the neck issue, peripheral neuropathy down the arm, you have ulnar neuropathy, you have C6 radiculopathy, whatever the term may be, it just means that the nerve fibers, wherever the path lies, you have a little bit of a constriction. If you can think about the traffic jam in the freeway, Spaghetti Junction here in Georgia. If you have a traffic jam somewhere and you're getting to point A to point B, well, if you can't get to point B, that means there's a disruption in the flow. That's the same thing with the nerves. If you don't have blood supply because it's a constricted somewhere, we can figure that out by EMG and NCV testing, which is a nerve testing that we can certainly do. But really functionally, we can really address that by trigger point dry needling, setting the bones in properly so that they're aligned from left to right, setting the base to its optimal state where it's measurably like aligned properly, and then retraining those muscles so that they activate properly. And that's why here at Alkaline Physical Therapy, we're all about core strengthening, really balancing the flexibility with the yoga therapy, and then really making sure we're breathing properly, respiration, and really mindfulness to that so that we can have meditative motion through Qigong practices. And that's why we founded the term Yo-Ki Laddis, kind of incorporating all three principles. So having said that, the peripheral neuropathy can be reversed. Don't ever forget that. A lot of my patients have come back with bursitis and they go in for surgery, and a lot of times, and I can assure to this, that a lot of the times it's been a disaster. You want to keep the parts that you have. It's a God-given right, and you want to keep those parts as long as possible. Discectomies, laminectomies, and lumbar fusions or cervical fusions, all these are things, in my opinion, something to be prevented, and so that you can have your lasting parts like wear out with you with your growing age. And we want to pay mindfulness to them so that we stay properly aligned, so that we keep our parts and decrease inflammation and live a life full of potential and function.